Hello, I'm Stephen Blair. I'm the director of the Liverpool Varicose Veins Clinic, and I'm a consultant specialist varicose vein surgeon. What's the best way to get rid of varicose veins? The answer is not simple, I'm afraid, because all treatments can achieve 95% success rates in trials. But trials don't always follow through to the same results in clinical practice. There are three things, therefore, to look at. What are the side effects of the different treatments? Who are you going to get to do it? And how much does it cost? Having tried a variety of these over the years, I now use clarivein ablation. This is a mechanical ablation. A little wire goes up inside the vein under a tiny bit of local anaesthetic. You don't really feel its presence until I press a button. And then it feels like an electric toothbrush. There's a vibrating sensation as the wire spins around inside the vein, destroying it. At the end of the procedure, you can get up and about, you can bend your knee fully, and you can return straight to work or drive home. Surgery is only needed occasionally for very major varicose veins these days. The range of treatments varies. There are those that burn the vein away. That includes laser, radiofrequency ablation, and ultrasound-guided external radiofrequency ablation. All of these require multiple injections of local anaesthetic, up to 200-300 mils, which can be quite painful, cause great tightness in the leg, and also the recovery time is about 48 hours. One of the reasons for needing this local anaesthetic is that if you burn the nerves that run down beside the veins, then you can end up with nerve damage, which can be permanent. This only occurs in about 3% of people, but if it does, it's very worrying. So rather than burning it, people have tried cyanoacrylate glue, that's super glue, which works. But on the other hand, up to 25% of people get allergic reactions to it. And because you can't remove the glue, then those reactions can carry on for weeks and require medication to settle down the symptoms. Foam sclerotherapy has to be done by a real expert. In trials, people have had very varied results. Some people with 100% success rate, others with 25%. And therefore, I would only recommend that for somebody who uses that very frequently. Having said that, foam sclerotherapy for smaller veins is essential for almost all treatments, because once you've used a laser or clarivein or whatever to remove the main vein, the small veins, the ones that bother you, the ones you see, will require foam sclerotherapy. And that causes some lumpiness and discoloration that goes on for a few weeks, but is a very good treatment. So who are you going to get to do it? Well, my top tip is go to somebody who is doing a lot of this. It really needs to be a specialist varicose vein surgeon who's doing it 2-3 days a week. And finally, we come to price. Prices are much more expensive in the south of England, and you can have exactly the same treatment in other parts of the country. And a 2-hour journey up to Liverpool can save you hundreds, if not thousands of pounds. You also need to look to see how the price is made up. Is there a free ultrasound scan involved in the consultation? Does the procedure include a free follow-up and any foam sclerotherapy required at that appointment? Get your global price, find the surgeon that you like, and then you will get a good result. I hope you found this useful. If you need any more advice, please ring the Liverpool Varicose Veins Clinic and we will be delighted to help you. Thank you very much.